Okay, in this video, we're going to do the physical head-to-toe assessment. Good morning, sir. My name is
Yes.
Lorraine. I'm your PSW student, and I'm going to do your head-to-toe assessment. May I know your name, sir?
I am John.
Okay, do you know what are we going to do now?
Yes, I am going to have a physical assessment for today.
Okay, may I check your name, please?
Yes, here it is.
Okay. So at the first glance, you can now check the physical appearance of the patient. At first, we're going to take his vital signs. The normal blood pressure is 120 over 80. And we also have to check for his respiration. The respiration is 12 to 20, and his pulse is 60 to 100. And then while checking his respiration, you should check the rate, the rhythm of the respiration. And if you check his pulse, so while checking on his pulse, you should also check the rate and the rhythm and the strength of his pulse, if it's weak or steady. Okay. And then after recording his vital signs, we also have to check his weight and height. Okay, sir. May I check your weight and height,
Yeah.
sir?
Yes.
So for example, we have here weighing scales and uh, that's the height. If we're asking the patients to stand up, we can now check his muscle strength, and then his if he can move freely, and if he doesn't have any difficulty of moving. Okay, sir, can you please sit down? Sir, do you have any pain right now?
No, I don't have any pain.
Okay. Do you want to go to the restroom first to void before
No.
we do your physical examination?
No, I'm good. I'm good.
So you should ask your patient if the patient wants to go to the restroom first or void first, for him to be comfortable during the physical examination. Okay, at first, um, I will ask the patient to remove his glasses, and you should also take note of that if the patient is using any glasses. So, sir, can you be remove your
Yes.
eyeglass? Okay, we have to start on the patient's head. So, sir, I'll just check your hair and
Yes, sir.
scalp. So, while assessing the head, you should check for any lesions, any dandruff, or any abnormalities in the hair and scalp. Okay. And also, you should check the eyes of the patients for the asymmetry. You can also use the pen light if the to check for the perla, for pupil, if the pupil is reacted to light and accommodation, and if his eyes is reacting asymmetry. Okay, sir. Okay. You can also check if there's any abnormalities on the eyes. And after checking the eyes, you can check now the patency of the nares. Sir, can you please cover your nose
Yes.
and check for the patency of each nose, each nares of the nose. The other side, sir. Okay. You can also ask if there's any pain while checking for the patency of the nares, and then check also for the mouth. Can you please say ah?
Ah.
You should check if there's any abnormalities on the mouth, like if there's a dryness or any irritations on the mouth or ulcerations. The normal mouth would be pinkish, and the gum should be pinkish and moist as well. And then you should check the ears if there's any lesions and any abnormalities. And you should also check if both ears are both symmetry. And you can also check the neck. Palpate each carotid. And check for any lumps and any abnormalities. Okay. And then after that, you should assess for the chest of the patient. Okay. While assessing the chest of the patient, you should check for any lumps or any abnormalities that you can see, and then you should also check for the apical pulse. The apical pulse is located in the left mid-clavicular line into fifth intercostal space. So you can locate the apical pulse here. While the patient is sitting, you can now check for for his back. Sir, can you please here? So, checking on his back, you should check for the color of his back, any abnormalities and any lumps that you can see. And while checking on his back, you should check for the symmetry of the lung expansion. So, you'll be putting your hands up here. So, sir, can you please inhale?
Okay.
And then exhale. Inhale. And exhale. Okay. As checking on his back, you can check any abnormalities or adventitious sound on his back by auscultation. Inhale, sir. Exhale. Inhale. Exhale. Inhale. Okay, exhale. You should take note if there is any adventitious or abnormal sounds that you can hear. So, while he's sitting up, I will now assess his upper extremities. So, should check the capillary refill of both hands. Okay, the other side, sir. Okay. Check his fingers if there's any abnormalities. Check his shoulders if it's a symmetry. And you can also notice if there's dislocation on the shoulders or the fingers or the upper extremities. And you can check for the skin turgor. If you because you can notice if there's any signs of dehydrations. And then you can also check for the muscle strength. Sir, can you please squeeze my hands and my fingers? Okay. You should take note and ask the patient where is his dominant hand, because dominant hand is more stronger than the non-dominant hand. Okay, after assessing the head, the face, chest, and his upper extremities, I can now ask the patients to lie down to check for his abdomen. Sir, can you please lie down on the bed? You should give comfortability for the patient if you are assessing for his abdomen. Should not expose the patient. Okay, so for the assessment of the abdomen, we'll do the inspection first, and then the auscultation and the palpation. So, sir, can I
Yes.
move the blanket. Okay, I just put that a bit. Thank you. So you should inspect for any abnormalities, any lumps that you can see on the abdomen. And then after inspecting, you can now auscultate it. The auscultation would start on the right lower abdomen, and then going to the right upper, and the left upper, and then left lower quadrant of the abdomen. And then after auscultation, during the auscultation, you should the normal is you should hear normal bowel sounds. And if you cannot hear any bowel sounds while auscultating the patient's abdomen, you should hear it, or you should auscultate it in 5 full minutes. And then after the auscultation, you can now palpate it. Start again on the right lower quadrant, going to the right upper quadrant, and left upper, going to the left lower quadrant. So you can check any abnormalities. And sir, during my palpation, can you or do you feel any pain?
No, it's
Or any discomfort?
nothing.
Okay.
I don't feel anything.
So, and then after the abdominal examination or assessment, we're going now to the genital assessment of the patient. So for the male patient, you should ask him like, sir, are you doing your testicular examination
Yes,
every month?
yes.
Okay, so do you find any abnormalities during your testicular examinations? Or
I don't. It's quite normal. I don't feel anything. No pain, and that's fine.
okay, and then do you have are you sexually active or
No.
okay? And then you should ask the patients as well if there's any discharge. Do you experience any discharge or any foul odor that you're checked?
Everything's normal. Yeah.
Okay, how about your voiding, sir? Do you usually void every morning or?
Every morning, and yeah, most often if I drink a lot of water, so yeah.
So that's normal. There's no pain. There's
No pain. Yeah.
Okay, so you should encourage the patient every time that they should be doing their testicular examinations every month, and then for them to check if they have like any prostate cancer or testicular cancers. And then after doing the genital examination, while doing the genital examination, you should give privacy to the patients. And after the genital, you can check for any hemorrhoids. Do you have any hemorrhoids or history of hemorrhoid?
No, I don't have it.
Okay, if you're having your bowel bowel movement, are you having any pain?
No. I'm a regular. Yeah, I do it every morning.
Every morning.
Yeah.
Okay, so you can take note of it. And then after that, you can now check for his lower extremities. And then, sir, can I just?
Yes.
So don't expose your patients while doing your physical assessment. So for the legs, you can check for any abnormalities as well. Check for the capillary refill of both feet. Okay, you can check also the skin if there's any lesions or any fungal issues on his feet. And then you can now assess his muscle strength. Okay, sir. Sir, can you please push your feet towards me? Okay. Can you push your feet towards you, sir? Okay. By checking for any resistance on the feet of the patient, you're checking the muscle strength. Okay. So after doing the head to toe assessment, you should take note any abnormalities that you found in the patient, and then After doing such, you have to promote the safety precaution for the patient before leaving. Also, lower down the bed, um, raise the side rail, and make sure that the brakes are on. Thank you.